Good morning, everyone. Thank you very much, everyone, for tuning in to Pallium Canada's virtual annual general meeting today. My name is Gérald Savoie, and I have the honor and privilege of being the chair of the board of directors of Pallium Canada. I'd like to take a moment to honor the land that I'm residing in currently, which is the traditional unceded, unsurrendered territory of the Anishinaabe Algonquin people. Pallium is incredibly grateful to be able to work on these lands and to advance the quality and accessibility of palliative care for all Canadians. Bonjour et bienvenue. J'aimerais remercier toutes les personnes qui assistent à l'Assemblée générale annuelle de Pallium Canada aujourd'hui. Je m'appelle Gérald Savoie et j'ai l'honneur et le privilège d'être le président du conseil d'administration de Pallium Canada. J'aimerais prendre quelques instants pour honorer la terre sur laquelle je réside actuellement, qui est traditionnellement le territoire non cédé de la nation Anishinaabe algonquin. Pallium est profondément reconnaissant de pouvoir travailler sur ces terres et d'améliorer la qualité de l'accessibilité des soins palliatifs au Canada pour tous les Canadiens. Again, thank you very much for your time today. So we'll begin the annual general meeting with the first item of business, which is the chair's remarks, les remarques du président du conseil d'administration. I'm extremely pleased to share that we have two special guests with us today, Federal Minister of Health, the Honourable Jean-Yves Duclos, and Ontario Minister of Long-Term Care, Paul Calandra. Thank you both for your remarks today. Against the backdrop of an evolving pandemic, Pallium Canada sharpened its focus on building and sharing knowledge, advocating for support, and helping healthcare professionals and communities adapt and respond to the needs and challenges. Together, we have stepped up and are stepping forward to build a future where every Canadian is able to receive quality palliative care. Over the past year, we have demonstrated our unwavering commitment to our vision that palliative care is everyone's business through our efforts in advocacy, research, education, partnerships, and community engagement to advance palliative care in Canada. Strong advocacy efforts with government leaders. Times are changing, and we absolutely need to fix what is broken. So we've done an awful lot this year in terms of advocacy and engagement on those bases. We also rapidly expanded our innovative palliative care ECHO project to 11 hub partners. Welcome. Our collaboration with over 170 LEAP, ECHO, and corporate partners enabled us to reach new audiences and provide new solutions. Launched our Care Connections program that's designed to empower community engagement and support the millions of Canadians who are caring for family, friends, and members of their communities. Pallium is moving forward with renewed passion and purpose to be an important catalyst for the transformational change we want to see in palliative care. Building on more than 2 decades of experience and a legacy of impact, Pallium is excited by a new chapter where we will be amplifying our voice and strengthening our role as an advocate through advocate and thought leader to galvanize more support and action. We have an ambitious agenda, and it's one that we can't do alone. Partnerships and collaboration have always been a core part of Pallium, and they continue to be instrumental in everything we do. Only by working together will we accelerate capacity building and improve palliative care in every province and territory. Our funding partners enable us to undertake our work to equip healthcare professionals and communities with the knowledge and tools to provide palliative care to every Canadian. I'd like to take this opportunity to thank Boehringer Ingelheim Canada Limited, la Caisse de dépôt et placement du Québec, the Canadian Medical Association, Health Canada, the Li Ka-shing Canada Foundation, the Sovereign Order of St. John and Jerusalem Knights Hospitaliers, the Arthur J. E. Child Foundation, and the Joan and Regis Duffy Foundation for their generosity and ongoing support. We have also welcomed several new members to the board of directors who will play a vital role in advancing this agenda by providing new perspectives and adding to diversity and experience. This completes our transformation. As I mentioned in previous annual reports, Pallium Canada was in a transformational phase, and that included governance as well. And I'm very pleased to see that that has occurred. We've also said goodbye to others who we will be recognizing a little later in the agenda. Pallium would not be where we are today without you, our community supporters. I would like to recognize and thank our staff, fellow board members, facilitators, learners, stakeholders, and funding partners for your tremendous efforts in this past year. It is not just what you've accomplished this year that matters, but how you did it with commitment and care for each other and those we serve. Pallium Canada looks forward to continuing to work with you to ensure that all Canadians have access to better palliative care. I'll finish my comments at this time and ask Pallium CEO, or number one cheerleader here, Jeff Moat, to share his remarks. Jeff, over to you.
Merci, Gérald, and welcome, ladies and gentlemen, to this year's annual general meeting. My name is Jeffrey Moat. I am the Chief Executive Officer of Pallium Canada. Bonjour tout le monde, je m'appelle Jeffrey Moat, je suis le PDG de Pallium Canada. Pallium's mission of providing practical and evidence-based solutions to increase the quality and the accessibility of palliative care has never been more important. And when I reflect on this past year, I have seen how Pallium has been fulfilling its mission at a time when it has mattered most. Lorsque je réfléchis à l'année écoulée, je réalise à quel point Pallium a rempli sa mission à un moment où cela comptait le plus. As I will be sharing in a few moments, our success is a testament to the trust our stakeholders, funders, clients, and thousands of healthcare professionals have placed in us, and the degree to which we have stepped up to meet the needs of those we serve and the challenges we have faced with the pandemic and a healthcare system that is in desperate need of reform. Next slide, please. I'd like to begin my update with a brief performance review of our LEAP courseware. I'm happy to report that LEAP session and learner volumes have made a strong recovery this past year and are projected to exceed pre-pandemic levels in the year ahead. At the outset of the pandemic, Pallium transitioned its course delivery from in-class to online. And since then, online delivery of LEAP continues to be very strong, with over 80% of learners participating through this channel. Having said this, there are a few early signs of a return to in-person LEAP courses, with some of our LEAP mini courses and our hybrid courses being conducted face-to-face. We've also completed the online adaptation of most of our course variants. LEAP PSW continues to be our fastest growing course. Almost 4,000 PSWs have been trained, with over 15,000 enrollments expected this year. Next slide, please. Training and education of healthcare human resources on the palliative care approach is an essential component of any strategy that aims, certainly at a population level, to improve the provision of palliative care and access to palliative care for citizens in all care settings. The good news is that evidence-based trusted solutions, such as LEAP, they already exist to quickly provide healthcare workers with the knowledge and skills. But to date, there's been a lack of leadership and commitment to spread and scale these proven innovations to achieve lasting improvements in healthcare practice, patient experience, health outcomes, and value for money, and frankly, work-life balance for healthcare providers. For over 20 years, Pallium has invested in an infrastructure to enable the spread and scale of its accredited LEAP courseware. It's thus very exciting to be sharing some important partnerships that we have entered into aimed at building palliative care capacity on a significant scale. The government of Alberta announced that in partnership with Alberta Health Services, Pallium Canada will be working to equip healthcare practitioners with the core competencies to be able to provide much needed innovative approaches to palliative care by leveraging LEAP. That's province-wide. From the same provincial grant, Pallium Canada and the University of Calgary announced that they'll collaborate to develop the Canadian Atlas of Palliative Care Alberta edition. Similarly, with the government of Newfoundland and Labrador, Pallium has entered into a multi-year licensing agreement to train PSWs and supportive care assistants across the province. And we were also successful at entering into multi-year licensing agreements with two national long-term care home providers, Extendicare and Sienna. And they're going to see their staff train throughout their long-term care networks using LEAP long-term care and LEAP PSW. These partnerships are significant because they represent a commitment to providing groundbreaking and innovative educational reform to palliative care on a very large scale. These partners recognize that LEAP training has demonstrated success in improving outcomes and reducing cost and strain on our health systems. Healthcare professionals will receive best-in-class training that will now be standardized, ensuring that our healthcare heroes can provide the best possible support to those with a life-limiting illness and their families. Next slide, please. To affect system-level change and a culture change, a critical mass of healthcare professionals across the whole healthcare system need to become acquainted with the palliative care approach and be able to apply that. A patient with heart, lung, or kidney disease, for example, will not benefit from early palliative care if his or her specialist has not been oriented to the approach. That patient's family physician or home care nurse is not able to apply the palliative care approach if there exists a discord between what their family physician is saying and what the specialist is advising. The strategy of developing different LEAP versions to address different settings of care, different diseases, and different specialty areas is critical to affect culture change across the whole healthcare system. Past experiences when only one LEAP course version was available clearly demonstrated that learners will not attend a program that doesn't resonate with their daily workplace needs and realities. Courses need to reflect their particular field and setting of practice and patient profiles. So I'm pleased to say that over the past year, Pallium's completed the development or online adaptation of 7 courses that you see here. Next slide, please. How do we measure success? Well, we measure success in many different ways in terms of the performance of our course, in terms of the feedback we receive from our learners. And this is one that I think is really worthwhile calling out. And this is from Madison Weiss, who's an instructor at the First Nations Technical Institute in charge of the personal support worker program. And this is what Madison shared. We offered LEAP personal support worker as a value add to our program so that students could expand their knowledge in palliative care and improve their employability skills. After successful completion of course, students were able to apply the learning and new skills directly into their practice. Moreover, after the completion of our course, multiple learners stated a new passion and increased interest in working as a personal support worker in a palliative care setting. The LEAP certification also formed a basis for high specialization, resulting in higher starting wages for our graduates. Students in the program had such positive feedback about the Pallium course that FNTI intends to make it a regular practice to enroll their PSW students in the LEAP program moving forward. Well, that's very exciting to see. Next slide, please. Now, in addition to developing evidence-informed accredited LEAP content, the healthcare system requires sustainable infrastructure to rapidly capture and share palliative care knowledge, tools, resources, and protocol changes among healthcare teams across the country. To that end, 2 years ago, Pallium launched the Palliative Care ECHO project. This is a 5-year national initiative that's funded through a contribution agreement with Health Canada that cultivates communities of practice and supports continuous professional development among our healthcare providers right across the country who care for patients with life-limiting illness. This past year, the Palliative Care ECHO project was thrilled to announce the launch of its new website, echopalliative.com, and the snapshot of the homepage you can see on the slide. This new website aims to make it easier for visitors to learn all there is to know about the Palliative Care ECHO project and have easier access to upcoming ECHO sessions that are delivered either by ourselves or by our hub partners. So if you visit that website, echopalliative.com, be sure to view the brief promotional video that also provides an overview of this initiative. So in addition to my report to you last year, we have more than doubled the number of hub partners to 11. So our new partners include North Simcoe Hospice Palliative Care Network, the Northwest Regional Palliative Care Program, Saskatchewan Hospice Palliative Care Network, the Canadian Society of Palliative Care Physicians, Médecins Francophones Canada, and most recently, Covenant Health. Recently, Pallium Canada officially became an ECHO super hub through the ECHO Institute in Albuquerque, New Mexico. And we're thrilled about achieving this designation and excited to be joining the ranks of 32 other ECHO super hubs across the globe. Super hubs are defined by the ECHO Institute as experienced ECHO partners that train and support new hubs while maintaining their own ECHO programs. So being a super hub formalizes Pallium Canada's role with the palliative care echo project and has the potential to accelerate the spread of more palliative care focused echo hubs across the country. Pallium Canada will have access to learnings from other super hubs around the world and be able to provide tailored echo immersion training to support organizations to become official hub partners under the Echo Institute. Next slide, please. Now, since the inception of the Palliative Care Echo project, it has delivered some 142 echo sessions with almost 8,000 learners having joined an echo webinar session. And there's another 8,000 that have viewed one of the recording sessions online. We've developed 4 communities of practice, including long-term care, heart disease, community-based primary palliative care, and a community practice for personal support workers. There's been 2 quality improvement initiatives that have been launched that support healthcare providers in the early identification and assessment of individuals who would benefit from a palliative care approach in the primary care setting. We also launched a palliative care journal watch program that keeps participants up to date on the latest in palliative care literature. And our hub partners themselves, well, they've held 85 sessions, which have included such topics as pediatric palliative care, psychosocial care, palliative care in rural and underserviced communities, pain and symptom management in the home, to name just a few. Next slide, please. Now, while our scientific officer in just a moment will be providing a comprehensive update on our research and evaluation activities, there is one project that I'd like to highlight that is significant in scope and strategically important to Pallium as our role as thought leader. Despite an increased need for palliative care service provision due to an aging population with multiple chronic conditions, access to and availability of palliative care services remains challenging in Canada and within the provinces and territories in their respective health regions. Unfortunately, currently, there is no single reporting source or data repository for palliative care in this country. Some data exists, but in various reports and in different forms and formats with significant variation across Canadian jurisdictions. Pallium is looking to change that through the creation of a Canadian Atlas of Palliative Care. An atlas is, simply put, a graphical representation and a textual description of the current state of palliative care in a given jurisdiction. And we're approaching an important milestone in this project. Later this fall, we will be producing a mini atlas for 3 local health integration networks in Ontario, which will give us a sample of what an atlas will look like and the type of data it captures. We've received generous financial support from the PSI Foundation for the development of the Ontario Atlas, the University of Calgary through a Government of Alberta grant for the Alberta Atlas, and also from the Sovereign Order of St. John for a BC Atlas of Palliative Care. Next slide, please. Let's face it, Canadians value strong institutions that are central to our core identity: health, education, sound economics, and respect. Over the last year, cracks in our healthcare systems have been exposed, leaving Canadians concerned by our systemic failure to support our citizens and our most vulnerable. Healthcare costs are escalating as a consequence of failing to adapt to changing demographics of Canadians and advances in chronic disease management, including cancer. Change is now long overdue. Continued failure to invest in palliative care will be a lost opportunity to achieve better results, better efficiencies, and improved outcomes for Canadians. The status quo neither meets Canadians' needs, nor is it financially sustainable. Palliative care stakeholders need to act quickly to take advantage of any future opportunity to promote access to high-quality palliative care. To date, this has been hampered by the inadequacy of historical funding and the unlikelihood of future funding given the current economic climate. The time has come for a system-wide solution and strong, decisive leadership that is willing to move past incrementalism and tinkering at the margins to true transformative change. The federal government's investment in Pallium has paid tremendous dividends. Pallium is well positioned to leverage its past successes and its current infrastructure to provide national leadership through its collaborative pan-Canadian network and partnerships to mobilize positive systemic change. As a thought leader and key influencer that helped drive system change in palliative care in this country, Pallium must continue to evolve beyond its well-established roots of developing and disseminating a spectrum of interprofessional education resources and leverage its networks, its talents, its expertise to share insights, best practices, and innovations that challenge the status quo and influence and inspire and advance the palliative care approach and health system across this country. To this end, we've begun, we've actually developed and already begun implementing a national government relations strategy. And this is aimed at raising the profile of Pallium among key influencers and governments across the country to help profile and support Pallium's priorities. Pallium's goals are very much aligned with Health Canada's framework on palliative care and the blueprint for action developed by the Quality End of Life Care Coalition of Canada. As a result, we will be seeking support from our stakeholder community to join us in pressing for change. Next slide, please. Successful initiatives like what I've just described all have one thing in common. They have all engaged with stakeholders and community groups and manage these relations proactively rather than reactively. When stakeholder engagement is done effectively, it improves communication channels between parties, it creates and maintains support for work such as ours, it gathers information and intelligence for the organization, and it helps reduce the potential for conflict and enhances our reputation, ultimately our enhanced mandate. One such stakeholder coalition is the Quality End of Life Care Coalition of Canada, or what is often referred to as the QELCCC. The Quality End of Life Care Coalition of Canada is a group of 35 national organizations dedicated to improving end-of-life care for all Canadians. The coalition believes that all Canadians have the right to quality hospice palliative care, including grief and bereavement supports. And to achieve this, there must be a well-funded, sustainable national strategy for hospice palliative care. And it's the mission of the QELCCC to work together in partnership to achieve this goal. At the QELCC's semi-annual meeting that was held this past June, it was announced that Pallium Canada would assume responsibility for the secretariat of the QELCCC for a 3-year time period. Pallium is honored to assume this role. The QELCC is an important coalition created to develop and amplify a collective voice on issues of importance in palliative care and identify and initiate opportunities for collaboration and provide a national forum for members to share information. I firmly believe this coalition has the power to transform palliative care in Canada to ensure all Canadians have access to earlier, more effective, and more compassionate palliative care. Next slide, please. When we reflect on where care takes place, family caregivers provide more than 80% of the care needs for patients with serious illness or long-term conditions. They contribute $25 billion in unpaid labor to our health system. And with Canada's aging population, the number of caregivers and the support needed from those caregivers is expected to increase. Over the past year, Pallium has been hard at work creating a suite of resources and activities to support the millions of Canadians who are caring for their family, friends, and members of their community. These resources that make up what Gérald referred to earlier as our Care Connections program, these are provided free of charge, and they're designed to empower every Canadian to better support the caregivers in their lives and to help strengthen the important social connections within our communities. The Care Connections program is made up of 4 elements. One is the Atlas Care Map Toolkit, and a care map is a simple visual diagram of the people involved in providing care to a caregiver and the care recipient. We have an Atlas Care Map Community Workshop Toolkit, and this workshop toolkit is a resource for anyone who would like to run a care map workshop in their neighborhood or community with a goal of increasing awareness and understanding and the use of the care map tool and how it can help caregivers and care recipients. We have our Social Connections in Palliative Care, and this is a free educational resource actually designed for healthcare professionals to learn about the importance of social connections on patient health outcomes. And the 4th element is Leap Cares, one of the courses I showed earlier that we just launched. Next slide. Pallium has also been working with several companies that have leveraged Pallium's Compassionate Workplace campaign to create more compassionate workplace environments for their employees, including those who are caregiving and grieving. The Compassionate Workplace campaign is designed to help companies improve their care culture by proactively supporting those among us who are caregiving, grieving, or themselves living with a serious illness. A compassionate workplace culture can help to build resilience and help to transform the workplace into a source of support for those in need rather than being an additional point of stress or burden. The campaign provides resources that help build awareness and understanding of serious illness, caregiving, and grief experiences. It helps decrease stigma associated with serious illness. It raises awareness of resources that exist and supports. It helps prompt and enable supportive conversations, and it empowers people to create a more compassionate culture. Pallium is partnering with several healthcare consultants across the country who are bringing this important initiative to their respective networks. And I would encourage you to visit compassionateworkplace.ca and consider undertaking this initiative and help to create a more compassionate workplace. Next slide, please. I hope that the accomplishments that I have shared inspire you and serve to underscore the important contributions Pallium is making to improve palliative care in Canada. So this brings us to our road ahead. As Pallium begins to work with its partners on the rollout of several large-scale training activities that I described earlier, it is critical that we execute our responsibilities with excellence. We have to exceed our partners' expectations and learn from these experiences so that we can replicate success elsewhere. And to ensure that we have the greatest impact with the resources that have been bestowed to us, it is critical that we stay focused on high priority sectors such as long-term care, home care, and hospitals where there exists a strong need for focused support. As many of you know, Pallium's course content and learning tools are constantly changing and evolving. I'm not sure if you knew this, but every year, Pallium affects legally required mandatory changes to all courses. We reevaluate our learning instruments. We make updates to reflect changing medical practices. We incorporate feedback from our learners and facilitators, and we resubmit to accreditation bodies, just to name a few of the tasks. But we've reached a point where we need to update some of our core content to ensure that we continue to deliver a premium, high-quality learning experience for all learners. And as our scientific officer will describe, we've begun implementing a research and evaluation plan to measure the impact of our LEAP and ECHO programs. And since Pallium does not have the internal resources or frankly the expertise to complete all aspects of our research plan, we will be providing grants to engage a new and growing network of palliative care, education, and impact evaluation research experts. As a national leader in preparing and supporting healthcare professionals to provide palliative care, we also play a vital role in addressing the current gap that Canadians face in accessing palliative care services. And as I mentioned before, there's an opportunity to engage more closely with federal, provincial, and territorial governments to elevate the need for greater investment in building palliative care capacity and establish Pallium as a valued partner and trusted advisor. And lastly, over the years, Pallium has been approached by many countries around the world to adapt our learning tools and courses for the benefit of healthcare providers working in Israel, Spain, Portugal, the Caribbean, Japan, to name just a few. So we're going to begin to explore targeted opportunities to evaluate the viability of extending our value proposition beyond Canada's borders, which is very exciting. Next slide, please. And now I would like to finish by saying thank you. Pallium is a community. We're a community of clinicians, educators, facilitators, researchers, carers, subject matter experts, volunteers, Indigenous leaders, corporate partners, citizen advocates, all working together to accelerate the integration of palliative care in Canadian communities and healthcare systems. We thank all of you for believing in our work and supporting our mandate. I'd also like to extend a heartfelt thank you to incredibly supportive volunteer board of directors, both past and present, who have contributed their time, expertise, and counsel to helping Pallium achieve its objectives. And last, but certainly not least, thank you to our team. The management team at Pallium Canada, myself, José Pereira, and John Faulkner, we have the privilege of leading a young, dynamic, talented group of individuals who are smart, passionate, committed to improving palliative care, who continue to over-deliver every single day. They're a small but mighty team of individuals who collectively punch well above their weight, as we like to say, on every aspect of the work. Everything I have spoken about today is their work. Next slide, please. Finally, it is because of our funding partners and generous donations that Pallium can continue to deliver on our mission to advance palliative care in Canada. We thank everyone who has played a part last year. You've truly made a difference, and for that, we're extremely grateful. Thank you.
Thank you very much, Jeff. An excellent report. What a year. As you mentioned, we can never thank people enough, to you, to the team, to all of our facilitators, our partners, etc. Again, we can never thank you enough. And as I mentioned in my opening remarks, Pallium is definitely moving forward with renewed passion and purpose. I think there's more than enough evidence of that. And I wasn't overstating a moment ago that we have a very ambitious agenda. So without further ado, I would like to welcome Dr. José Pereira, our founder and also scientific officer, for his message today. Dr. Pereira, over to you.
Thanks very much, Gérald. And hi, everyone. I'm José Pereira and scientific officer, and as you heard, co-founder of Pallium Canada. And I'm also professor of palliative care in the Division of Palliative Care, Department of Family Medicine at McMaster University. And today what I was hoping to share with you is highlight some achievements of this past year, provide some context for them, and then also highlight some directions moving forward into the future. But before I do that, I really want to say a very big thank you to tens and tens, if not hundreds, of subject matter experts, peer reviewers, educators, facilitators across the country who all form part of this community called Pallium Canada. Everyone putting in their weight, putting their expertise, the generosity of their expertise and insights to develop the different programs. As you heard in the CEO report, the programs we have are broad, but I will be focusing mainly on the LEAP and the ECHO programs. But don't forget, we have the Compassionate Communities programs, amongst others. Next, please. So let's look at this past year, 2021 to 2022, and here are just some of the highlights. The last 2 years have been extremely, extremely busy, as everyone else has experienced as well in the healthcare sector and in all sectors because of the pandemic. We were very quick off the mark when the shutdown occurred in the middle of March 2020. Within 3 weeks, we were already online with online versions of LEAP Core, which is our 2-day course that targets healthcare professionals, that's doctors, nurses, pharmacists, social workers, etc., working in community settings. Soon after that, we were online with LEAP Long-Term Care, the fully online version. And that work has continued over the last year. We've now developed online and hybrid versions this past year of LEAP Hospital, LEAP Lung, and LEAP Heart. And I want to highlight very shortly in another upcoming slide why this is so important, why it's so important to diffuse the palliative care approach across not just cancer, but non-cancer illnesses as well. And so this is part of our strategy to equip healthcare professionals across different care settings, professions, and specialty areas with these core competencies that make a difference to patients and their families. In developing these courses, we've taken an approach. In developing these courses, we've taken an approach of designing them in such a way that we can pivot really rapidly when needed. So, for example, the webinar parts of our online courses. So the online courses have got 2 parts. The first part, the learners do self-learning online. And the second part, they then come together by way of webinars to learn together in small groups using cases and apply what they learned in the online self-learning modules, apply it in with cases and learnings from each other and learning from different professions. And I'm going to highlight that one more time. Since the beginnings in 2000, and in fact, going back to 1998, with the PalCare EdNet project that really was the predecessor of LEAP, we've been advocating for collaborative work, teams working together. And it's become so important now in the challenges that we face with the healthcare system. It's going to take collaborative efforts. And so our courses are developed so that different professions can come together. And that's extremely, extremely important. And we've got evidence, and we've published that, including in this past year, some papers highlighting how one of the outcomes of the courses was different professions saying, I've learned a lot about what the other professions do and how we can all collaborate and work together to improve patient care. And moving forward, that's important because all our courses are also based on competency-based education. In other words, we look at what competencies have been mapped out for the different professions and the different care settings. And there have been many competencies now, or competency grids developed across the country. Started in Nova Scotia. Pallium had started that already back in 2001. We came up with some competency grids already. More recently, a few years ago, Nova Scotia developed a competency grid, and then British Columbia and Alberta, Ontario have followed, as well as the Canadian Partnership Against Cancer. And so we use those competencies to ensure that the courses are as best as possible aligned with those competencies. But it's also important to understand that in some cases, if the goal is to bring different professions together, it is very difficult to address every single profession's specific learning needs. And so sometimes there's got to be some give and take if the goal is to bring these professionals together, to learn together in order to work together. So now we've got Leap Lung, and I was just saying how the design of the courses, those webinars, the second part of the online courses, can also be used in a classroom setting. So those webinars actually become now products that we can use not just for online learning, but also in the classroom. And so that's given us a lot of flexibility, and we begin to see now more and more organizations saying they'd like to take on that hybrid approach with some self-learning, but then bringing people together to learn together. Leap PSWs, as Jeff alluded to, has been a big product. We close to completing some additional LEAP online and hybrid versions, including LEAP Renal. That's been a complete update of that course, LEAP Emergency Department, and LEAP Pediatrics. It's important to highlight here that for each of these courses, every time we do the updates, we look at the literature, we go to subject matter experts, and we ask, how have things changed? So for example, with the LEAP Heart, there have been new practice guidelines coming out by the Canadian Heart Society, the American Heart Association on the management of heart failure. So we've got to incorporate all of those. And that's just one course. We do the same with all the other specialty areas and the courses that target primary care providers. Next, please. This is the study that I was alluding to earlier. This was a study that was conducted by colleagues of ours in Toronto, Ottawa, and Hamilton. And what they did was they went to large population databases that are kept by ministries, and they looked at what is the impact of integrating palliative care across different disease groups. And on the left-hand side, you see the list of the disease groups. So there's cancer, there's dementia, heart failure, lung disease, so COPD, end-stage kidney disease, that's the ESRD, stroke, and cirrhosis. And if you look at those diagrams, all those dots that are to the left of that vertical line, that line that says 1, all the dots to the left indicate a significant reduction. So when palliative care is integrated into the care of patients with these different disease groups, in most cases you see reductions in emergency department visits and reductions in hospital admissions. Now, how important is that in the context of the challenges we are facing today and will be facing for the next few years on pressures on our emergency departments and our hospitals, and the importance of building up community-based resources to help achieve that. The authors of the study concluded, and you see on the right-hand side, by saying that because of these findings, we should make extra effort in ensuring that all the healthcare professionals caring for these patients have got these core palliative care competencies, which is what LEAP and ECHO is all about. Thanks. Next. So evaluation work is ongoing. As Jeff indicated earlier on, we update courses at least once a year, and we do major updates every 3 years. Our self-learning online modules is due for a very big upgrade, updating next year. We integrate as best we can latest practices. And importantly, we look at the evaluations coming in from the learners and feedback coming in from the facilitators across the country so that we can make adjustments to the courses to reflect the input, so that it's always a very positive and an impactful learning experience. We've just completed and submitted 2 studies. The one is for LEAP long-term care, and there we asked the question, do learners implement what they learned in LEAP long-term care? Our findings indicate major applications of what they learned across several domains, including early identification of patients with palliative care needs when they first admitted to long-term care, much better goals of care discussions and advanced care planning discussions, better symptom assessment and symptom management, and importantly, better support of families, and also better support of each other as healthcare professionals. And that's important given the burnout that we're seeing in some sectors across the healthcare system. We've also just completed a study where we asked the question, having done a LEAP long-term care, did that make any difference for you as a doctor or a nurse working in long-term care during the COVID-19 pandemic? And this qualitative study identifies many areas where the learners felt it made a very big difference as they coped with the large number of deaths occurring in long-term care and the suffering that went around that. We've published several papers in this past year. I've highlighted just some of them. They include studies on, do learners who do the LEAP core, which is the community-based course, do they implement what they've learned? And there is evidence and very strong signals coming from that study that they are implementing what they learned. So there's impact. And we're also learning that the learners find this a fantastic learning experience. Then lastly listed there was a study with the Integrate project in Ontario, where we integrated palliative care into 4 family health teams and 4 cancer centers. And LEAP was part of a multi-pronged approach to do that. And we've published some results around that, where the participants in this family health team said the training helped them identify patients earlier, initiate these important discussions, and also improve the care they're providing to their patients in the primary care sector. Next, please. I want to highlight some points around the ECHO program. We heard earlier on that the ECHO has got various components to it. One of them is webinars. And our partners have done an amazing job putting on webinars. We've seen fantastic uptake in Quebec, with hundreds and hundreds of people actually signing up to these webinars every time they delivered. Our communities of practice have really been evolving, and I see some of the folks who are part of these communities of practice online. Dr. Leah Steinberg and Dr. Carolyn McQuinty, for example, have done an amazing job with the palliative care integrated in heart care community of practice. And so we're going to be studying that soon to see how we can amplify that even further and spread and scale that even more. The big one that I want to highlight here is a palliative care journal watch. Across the country, we have trained over 900 facilitators. Many of them do not have access, do not have academic affiliations, in that they're not lecturers or professors in medical or nursing or other health science schools. And so they have more limited access to the literature. So by doing this journal watch, we've convened a team out of McMaster and Queen's, and we're hoping to broaden that in the months ahead to include colleagues from other academic centers across the country that are monitoring up to 16 journals on a regular basis, identifying papers that they think are very important to become aware of. as they can either confirm current practice or they can make us rethink current practices. So that's our work in trying to bring evidence to the bedside earlier, and thereby being change agents and care change agents. It also provides a platform for all these learners that have done these, thousands of learners that do one or other LEAP course or LEAP modules annually, to also connect up and be with the Journal Watch, and to be kept up to speed with some of the new emerging evidence and publications in the field. Next, please. The Canadian Atlas, Jeffrey has already spoken about that. He's highlighted the pilots that were done. Those pilots taught us lots. They gave us insights on how to update and tweak the methods that we're using to do this across the country. They helped us a lot in terms of getting Research Ethics Board approval through the various avenues that we had to do that. And also, as Jeffrey highlighted, made some really good connections with partners and colleagues across the country that will help us complete a Canadian Atlas in the year 23 to 24. Next, please. A unique feature of the Canadian Atlas is going to be that we're going to go to each of the provinces and territories. We've just shown you here four of the provinces, but across Canada, we see variability across the provinces in terms of access to presence of palliative care services, and also things like policies around palliative care services, resources, etc. So there's a lot of variability across the provinces and territories, but even within those provinces and territories, within their the different health authorities or zones or networks within those provinces, we see variability. And so the Atlas is designed to pick up not only on what's happening in the different provinces, and especially on the good stuff that's happening. A very big goal of the Atlas is to identify strengths and successes so that we can bring this to the attention of other regions where they may be struggling perhaps, or they're looking for inspiration. And we are able to, through the Atlas, to really connect them to innovation and excellent work happening in other regions. Next, please. Jeffrey did show a small excerpt from one of the atlases. This is just again to remind people what the atlas looks like. This is the Scottish Atlas of Palliative Care. You can see Scotland on the right-hand side with its different regions. And this particular submap of the atlas looks at the presence of inpatient palliative care, so inpatient palliative care units and hospices, including children's hospices across the different regions. There's also a space not shown on this slide for narrative. So for example, in our atlas, we're hoping to identify excellence and innovation happening in areas such as addressing the needs of homeless or vulnerably housed populations, and other populations that need special attention that have been ignored over the years. Next, please. We spoke very briefly about the evaluation and research framework. I shared this framework at last year's AGM. Again, just to remind people that we are working with experts across the country and in Europe, have developed an evaluation framework for the LEAP and the ECHO programs, and this is what informs our research. So for example, when we ask the question, what is the impact of the LEAP courses or the ECHO, we look at this framework and it says they're different levels, starting with the reach and the learning experience right up to the impact on the healthcare system, on patients' healthcare system. The higher the level, that's in that little middle box, it looks at impact. The higher the level, in this case level 4, we've chosen the quadruple aim as that level. The higher the level, the more resources required and more sophisticated studies needed for that. In order to do all this work and also evaluate implementation, and that's the lower box you see in the lower right hand, the yellow box, because that asks the question, what are the factors that help implementation, spread and scale, and what are the barriers to scale and spread, because we need to know those as well. In order to do all this work, we can do some of it in-house. More and more, we need partnerships like the McMaster Joshua Shared Research Hub. Next, please. In this coming year, we're pleased to announce that through the Joshua Shared Pallium McMaster Research Hub, which is a partnership between the Division of Palliative Care at McMaster and the Department of Family Medicine there, and Pallium, we've been able to secure a postdoc. And these are the studies that we're looking at as priorities. And they include the value added of the echo hubs, the impact of the echo communities of practice. So we'll be going to, for example, to people who participated in the heart community of practice and working with subject matter experts in those communities of practice to evaluate what's going well and what can we do to spread it further and be more impactful. Next, please. We've got tons and tons of data now on aspects of the learning experience and the facilitation experience. And so we can start exploring questions such as, what is the difference in terms of the learning experience and the facilitate experience and the impact when you compare fully online courses versus fully classroom courses versus hybrid courses. And we've got tons of data. If there are people on the call who wish to do some of their research in collaboration with us, please feel free to reach out. We've got lots of data. Next, please. Big work looking forward to conceptualize, to start preparing the ground today for studies in another 1 or 2 or 3 years time, is looking at the impact of LEAP at population levels. We've already got some of that. For example, the paramedic programs that occurred in Nova Scotia and Alberta and PEI, evaluations of those multi-pronged projects that included LEAP paramedics showed significant return on investments and significant reductions in emergency department transfers of patients and many more patients being cared for at home. So that's the type of data we want to look at with all the other LEAP courses. Next, please. So in conclusion, a lot of work happening by a lot of people, and I want to thank them again right across the country for doing all of this. We continue applying as best we can rigor, best evidence and best practices in not only the content, but also the design and the evaluation and the research, and lots of opportunities for anyone or organizations to collaborate with us. Thank you very, very much.
Thank you very much, Dr. Pereira. Again, I would say that Dr. Pereira really defines what passion and purpose is all about. Thank you so much. We've evolved, it isn't just program evaluation or we're taking care of the core. The data and research component is extremely, extremely important. And that's been evolutionary and revolutionary in many ways. And we are, believe through that data and research and so forth, that we are transforming practices, settings, and cultures as well. And last but not least, joining in with our academic partners to reach out and get to the learners before they begin their practice. So again, a huge thank you. A lot of work being done with a lot of people at all accounts. I'm sure with the decision makers and those who influence the decision makers, this is the kind of stuff that they can chew on with their policy advisors and so forth. So again, a huge part of the building block process to make sure that palliative care is a priority and remains a priority here in Canada. Thanks again. And now over to the next portion of our report, the financial report from Beverley Lepine, Bev, our Chair of Finance and Audit Committee. Over to you.
Thank you, Mr. Chair. Good morning. Mon nom est Beverley Lepine. Je suis le président du comité de finances et de la vérification et j'ai le plaisir de présenter les états financiers vérifiés pour l'exercice terminé le 31 mars 2022. Nos vérificateurs indépendants ont vérifié ces états financiers et ont fourni une opinion sans réserve qui se lit comme suit. In our opinion, the accompanying financial statements present fairly in all material respects the financial position of the Foundation as at March 31st, 2022, and its financial performance and its cash flows for the year then ended in accordance with Canadian accounting standards for not-for-profit organizations. The auditors commended Erin Kelly, our Pallium's financial officer, on the quality, continuing quality and comprehensiveness of her work. The board of directors passed a motion approving the financial statements for the year ended March 31st, 2022. The fourth quarter of the year ending March 31st was impacted by the Omicron COVID epidemic, reducing training and corporate partnership activity, resulting in a deficit of $418,000, slightly above the budgeted deficit of $365,000. The budgeted deficit reflected a strategic decision by the board of directors early in 2020-21 to use some of Pallium's surplus to invest in key programs in support of Pallium's mission, including the further digitization of its courses, compassionate workplace campaigns, and Indigenous engagement. Self-generated revenues in 21-22 increased 40%, with product and training revenues returning to pre-pandemic levels, and corporate partnership revenues were reported separately to reflect the continuing and future importance of this revenue stream. The strength of Pallium's ongoing investments in technology and in people, as you've heard from the previous presenters, and its focus on long-term financial stability through program investment are reflected in these results. The second year of a $5 million over 5-year agreement with Health Canada to deliver a palliative care echo project fully achieved its deliverables. Uncertainty due to COVID and economic risks continue to be the watchword for the coming year. But Pallium's balance sheet is healthy, with cash balances of $2.9 million and an accumulated surplus of $2 million. The board of directors also passed a motion following a formal procurement process and review to reappoint the Ottawa firm of Kelly, Hubers, McNeely as Pallium's auditors for the year ended March 31st, 2023. That concludes my report. Thank you et merci pour votre attention.
Thank you, Bev. Again, we never lose sight of sustainability and that whole foundational piece on the financial piece. Beverley is stepping down as chair of the finance committee this year, has been a staunch ally, and I must say a solid. Anyway, we've had so many conversations and meetings. I can't name them all, but in any case, a huge thank you to you. It's taken a strong arm to get us to where we are today and bringing Pallium again to the next level. A huge thank you. And now over to Donna Kingelin. Donna is chair of the Governance, HR, and Nominations Committee, and she will take over with regard to nominations and appointments. Donna?
Thank you, Jerry. I'm pleased to introduce our board of directors. The following individuals have been appointed to the board of directors of Pallium Canada for the year 2022-23. Gérald Savoie, Louise Bradley, Michael Anderson, Beverley Lepine, Jeffrey Morton, Deirdre Pike, Christine Power, Debbie Weinstein, and myself, Donna Kingelin. Plus, we have a new appointment of Anne-Marie Hourigan, and that is our board of directors for Pallium Canada. Back to you, Jerry.
So thank you very much, Donna. And now we're on to a very particular part of our meeting, a very proud piece, and that is remarks from two very important individuals. First, the Honourable Jean-Yves Duclos. And Minister Duclos could not be with us today, but he did send his remarks along, which I will be pleased to share with you directly. So to all Pallium AGM participants, for over 20 years, Pallium Canada has accomplished outstanding work to improve access to palliative care across Canada. The past 2.5 years have been challenging. The COVID-19 pandemic has tested us all, especially those who work in healthcare, with seniors and the most vulnerable. I commend you all for your dedication and continued advocacy in this challenging environment. It makes a difference every day. Notably, your LEAP courses continue to be acknowledged as a leading program of palliative care training around the world. Through this excellent resource available to a wide range of practitioners, you will help improve the quality of palliative care across the country. A truly remarkable achievement. I want you to know that the Government of Canada is just as committed as you are to improving palliative care. Palliative care is a critical part of Canada's healthcare system, and we will continue to work with partners like Pallium to improve access in both care facilities and at home. Budget 2021 provided $29.8 million to advance the government's action plan on palliative care. This plan aims for coordinated action on long-term and support care, as well as improving access to quality palliative care. This is in addition to the $6 billion in funding over 10 years provided in Budget 2017, which is helping provinces and territories improve access to home care services, including palliative care. Another $184.6 million over 5 years has been allocated to improve home and palliative care for Indigenous communities. The Government of Canada will continue to work with all of our partners to improve the quality and availability of palliative care across the country. Whether it's provinces and territories, people living with life-limiting illnesses, their families, caregivers, or communities, we all have a role to play to make palliative and end-of-life care more accessible to Canadians. The well-being and dignity of Canadians matters at all stages of life. Together, by enhancing access to palliative and end-of-life care, we can ensure that all Canadians live the rest of their days in comfort with support, empathy, and respect they deserve. I look forward to continuing to work with you to make this vision a reality. Thank you. Merci. Miigwech, the Honourable Jean-Yves Duclos. Thank you, Minister. Excellent remarks. And yes, we also look forward to continue our excellent work together with Health Canada and the government, the federal government per se. Just to acknowledge that the remarks, as well as other remarks that have been given today, are also available en français. So for our partners there, that is available as well. And now we did indicate ahead of time in calling the agenda in the meeting today that we had remarks as well and participation at another level. And we are now greeting the Ontario Minister of Long-Term Care. We're talking about the Honourable Paul Calandra, who is Minister of Long-Term Care, who has provided us with a very important message as well. So over to you, Minister.
It is a pleasure to join you at Pallium Canada's annual general meeting. For more than 20 years, Pallium Canada has partnered with healthcare organizations to build capacity by providing palliative care education and resources for healthcare professionals working in different settings of care in urban, rural, and Indigenous communities. Let me begin by saying thank you. Thank you for your ongoing commitment to ensure better access to palliative care resources and services across our province. Like yourselves, our government understands just how important and essential palliative care is. That is why we took the historic step to enshrine in legislation our promise and commitment to ensure that residents are guaranteed access to what we have called a palliative care philosophy in our homes. Pallium Canada too understands the needs of our aging population and has taken the necessary steps to equip and empower healthcare providers to support earlier, person-centered palliative care. With over 1,200 LEAP sessions held in Ontario to train over 19,000 healthcare professionals, our healthcare system and our long-term care residents are certainly better off. Our government is taking every necessary step to keep Ontario open. Recently, we announced our plan to hire more health professionals, free up hospital beds, and reduce surgical wait lists. We also passed the More Beds, Better Care Act that will help us ensure that everyone gets the care they deserve. We are on track to build over 30,000 new and 28,000 upgraded long-term care beds by 2028. This is the largest long-term care building program in Canadian history. Our government is also investing over $57 million over 3 years to increase the number of nurse practitioners working in long-term care homes. With all these new staff comes a new demand for exceptional training, and I know that Pallium Canada will continue to play an important role as a trusted partner of our government to ensure residents in long-term care and home care settings receive quality palliative care. Our healthcare system is facing an acute challenge right now. As a systems change agent, Pallium Canada is well positioned to rise to the challenge and equip even more healthcare professionals with the skills, knowledge, and confidence to provide earlier and more effective palliative care to patients and their families. I would also like to commend this organization for the work it has initiated through Dr. Joshua Shad, the Pallium Canada Research Hub at McMaster University, to create the country's first ever atlas on palliative care in 3 provinces, including Ontario. I'm grateful for the opportunity to provide this message, and in closing, I'd like to wish you all the best in your discussions today.
Very much, Minister. I think this speaks very well that we have government leaders and leadership speaking very highly of palliative care, its needs right across the country and in specific areas such as Ontario and so forth. This kind of support, engagement, and leadership is absolutely necessary and required. A huge thank you to all of the government authorities that have supported us as true partners in this endeavor as well. And now on our agenda is remarks from our new board chair. And perhaps before handing that over, I'd like to introduce our new board chair, Louise Bradley. Louise comes from a nursing background, but you probably know her best as the CEO of the Mental Health Commission of Canada. She's retired now. And of course, there is a huge connection there between mental health and palliative care and so forth. So we're very pleased to have her not only join the board, but participate at the most senior level. So Louise, welcome aboard. Thank you very much for accepting the duties and transferring, as I say, the baton over to you in terms of yet again taking Pallium Canada and bringing it again, if that can be, and I'm sure it can be, to yet another higher level. So now over to you, Louise.
Merci, Jerry. Bonjour, mesdames et messieurs. Je suis très heureuse d'être ici aujourd'hui. I am both delighted and honored to be assuming the role of chair of this wonderful organization. Having been the president and CEO of the Mental Health Commission of Canada for many years, I know how hard it can be in advocating in an area that isn't considered an integral part of the healthcare system. So I've watched over the years the work that's being done at Pallium. And as such, I've seen the tremendous work and leadership that Jerry Savoie has provided. So I'd like to take a few minutes to focus on that today because it's an important legacy and part of Pallium. Jerry has had a long career in healthcare and has been the chair of the board for the past 7 years. I think it's fair to say, too, that he started at a somewhat tumultuous time within Pallium, and that in the 7 years that he spent as chair, he really helped to stabilize the organization, having hired the current CEO and has attracted several excellent new board members. Jerry is committed to ensuring access to care for Francophones and all Canadians. And this was the hallmark in the latter part of his career, ensuring the relevance of Montfort Hospital, and consequently, Pallium now has a solid footing in Quebec, thanks to Jerry. He's also a strong champion of hospice, of residential hospices and hospice programs. He's a true systems thinker. I've watched him over the last couple of years challenge us as a board, challenge the staff to think differently and to think outside of the box. I'm very happy to say that he's staying on as past chair for the next year, for which I'm very grateful. I've got some pretty big shoes to fill. Now, typically at this point, we would be offering him a token of our appreciation. Jerry has opted instead to have a charitable donation made on his behalf. Jerry, on behalf of the rest of the board, Pallium staff, and the thousands of Canadians across this country who have benefited from your efforts, please accept our sincere thanks. It is a pleasure and an honor to work with you. Merci beaucoup.
Thank you again to everyone. This is everyone's business, and it's through the shared leadership. I look forward to working with you as well and supporting the board in that continuation. But I also take great relief in terms of seeing that with the new leadership and also the additional members around the board. We just finished our strategic planning meeting. And again, if there isn't enough evidence here that we're progressing and moving forward, there never will be. But again, a huge thank you on behalf of all the volunteers and volunteer work. So when I accept this, I accept it on behalf of everyone who is closely or remotely participated in this great endeavor that continues to be of importance. Thank you. And welcome aboard as chair. Now there's a special director's recognition, and again, there's an awful lot of thank yous, and they're well deserved. We never can thank people enough, and my special recognition today is to Dr. Srini Cherry. Srini, hopefully you may be on the line today, and I sure hope you are. So after over 2 decades as a director of Pallium Canada, Dr. Srini Cherry retired in 2021. As one of the co-founders of Pallium Canada and a dedicated champion of palliative care, Srini has been an incredible force of change for the palliative care movement. His strong and steady leadership has been instrumental to improving palliative care in Canada and impacting a countless number of patients and their families. Srini has been actively involved with Pallium Canada since its inception. He's one of Pallium's earliest LEAP facilitators and contributors on the initial LEAP curriculum design team. In 2006, Srini took on more leadership roles within Pallium, and in 2010, he co-led the establishment of what is known today as Pallium Canada Foundation and became a founding member of the newly established Pallium Canada Board of Directors. Srini helped Pallium Canada navigate through difficult challenges and remain operating during periods of minimal funding and resources. Srini's leadership was integral to securing more support and funding to spread the palliative care approach to every province and territory. His passion and work helped to train many of Pallium's over 900 facilitators, prompted Pallium's early adoption of the compassionate community concept, and supported its spread across Canada, and spread the message that palliative care is everyone's business. While Srini's accolades and accomplishments are many, it is a kind-hearted nature and generous spirit that makes an indelible mark on the people around him. Pallium Canada would not be where it is today without Srini. We truly thank Srini for his tremendous visions, steady leadership, a strong friendship in our journey towards better palliative care for every Canadian. And I will share with you that I've had contact with Srini most recently, and he now faces a major significant challenge personally, and our prayers and support are there with him as well. So again, to you, hats off, Srini. Thank you so much for everything you've accomplished. All of this is also reflected in our annual report, which I hopefully will take a few moments and read as well. So that brings us to the closing remarks. It won't be long in this one, but just again, a huge thank you to all of you. You are making a difference. We absolutely must move on and make sure that palliative care remains a huge priority. There's never been a time for palliative care, but now we are demystifying things. And I take solace in a sense and encouragement from the youth that are joining forces with us, be it in all of the healthcare professions, and to all of the partners and carers and caregivers. Again, a huge thank you. Et enfin, pour nos amis francophones, nos partenaires, tout ce qui a été présenté aujourd'hui est disponible en français. Ce sera mis sur notre site web, ainsi que vous pourriez aussi profiter de l'occasion de parcourir notre rapport annuel. Avec ceci, je vous remercie beaucoup, and I would like to thank you for joining us today. This concludes the annual general meeting of Pallium Canada for year 2021-22. Many thanks. Merci beaucoup.